You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
Welcome back to the program. Joining me now, Representative Aaron Pilkington, Republican of Knoxville, not Clarksville, although he represents Clarksville.
Yes, sir.
All right, I got that right. Dr. Nirvana Manning, she's head of OBGYN at UAMS. Good to see you both.
Oh, thanks for
Thank you for being
having
here.
Yeah, thank you for
Appreciate
having
you.
us.
So,
Appreciate it.
I did not, I don't always reach across two guests to shake hands there. All right, let's begin. Last week we had Maternal Health Awareness Day. This is an issue you have been active with at the legislature. It's obviously an issue you've been extremely active with. Dr. Manning, kind of set the scene for us right now. Where are we in terms of maternal health in Arkansas besides last? But explain why.
Okay, well, thank you again for having me on. So where are we in the state? The statistics are very sobering. The newest legislative report from the Arkansas Department of Health that presents the Arkansas Mortality Review Committee data was just published, I think, this week. And what we saw is that we think about 92% of these deaths are considered preventable. And what does that look like for our state? You know, Arkansas maternal mortality is something we have just recently really quantified. We suspected, and other places around the state have looked at these numbers, but it's something we can now put numbers to. Very similar to infant mortality that we have been looking at for a number of years in our state, which we also do very poorly. I think what this shows, these are representations of the overall health of our state. Yeah. It's just that we can now quantify these two elements in a different way.
And with that ability to quantify, this is an opportunity to legislate and make some policy changes to do this. You've been very active on that front. What is it about this debate that I guess motivates you to make as much activity and a difference as you've tried?
Well, I think for me, you know, we come here to serve the people, and this is a way to help improve the lives of the people. You know, I'm a pro-life Republican in a very conservative state, and I tell people all the time, you know, we need to put our money where our mouth is. If we say we're going to be the #1 pro-life state in the nation, we need to do a better job of taking care of our mothers and our babies. And so it's an area, like Dr. Manning said, where we perform very poorly in. And so I think there's a lot of room for improvement. And what's interesting enough for a state that's so conservative and fiscally conservative, you know, there's also a lot of savings that comes along with saving these lives, with providing better care. And so I think it's a really rich area. Now that we have the data and we've been tracking for a while, I think we can make improvements. And we've made some, but there's a lot more work to do. I say there's no silver bullet on fixing this issue, but there's more things to be done, and I'm excited for the work that we have done. It's a continual process.
Yeah, I want to keep in mind there's not a silver bullet to fix. There's not one thing that can be done to do this. You're part of a lot of working groups. You're part of a lot of working groups and conversations that are going on. Give me a couple of ideas. We'll limit it to two from each of you.
Oh,
How
goodness.
about that?
Okay.
Of just what would have a big impact if we could change.
You know, if I could pick two, I would say one would be perinatal regionalization. And what does that mean? That means that all of the delivering hospitals in our state could talk in a better and different way, such that if a patient needs to get from X to Y to potentially Z, that provider, that community, that hospital doesn't have to call all of these places. They can get to the next best place to take care of that patient. And the ones that really need to go to a tertiary care center could do that. That we kind of encompass that within the state and take ownership of that piece of it. The second would be extension of postpartum Medicaid to 12 months, such that these moms have the ability to get the preventative care that they need to prevent some of these ongoing issues in the next pregnancy, to get contraception if they desire, and to get the mental health kind of access that we see so often playing a role into the morbidity and mortality.
And how about this? You sponsored a bill to just do that exactly. That didn't go anywhere in the last session. I know it's going to come back, but you give me two solutions that you think could make a big difference.
Sure. Well, the big one is the Medicaid expansion to 12 months. That's a big piece.
Let me interrupt real quick there.
Sure.
That had a $1.8 million price tag on it. We have a $200 million budget surplus. Why could we not get that done? What were the obstacles for that?
Well,
it shouldn't have been money. honestly.
Well, yes, we did have a large surplus. I would say that it was worth spending the money to get it done. We also did legislation, whether it was the LARC expansion program by Senator Davis or the CGM legislation we did that also produced savings for our Medicaid budget to cover it. But one of the things that we were dealing with was we were getting off the public health emergency. We had people coming off the Medicaid rolls. We're trying to add people on. And then there's also just some confusion about, well, we already have Arkansas Works or private option, whatever you want to call it, our homes. And so there was an argument of, well, we've already got a good match with this. They should actually be going from this 60-day Medicaid onto probably one of those plans. And so they're saying that's actually what's happening. We don't really need this. And then come to find out, this happened, of course, near the end of session, you know, there was a gap. There's about 1,700 women were falling through this crack. And so still though going back and forth, was it falling through the crack because of is it a policy issue? Is it a, you know, are we just not doing a good job getting women from point A to point B? And so we've, you know, there's a little bit of, well, let's hold off and let's make sure that, you know, we fix the issue. And, you know, there's a 70-30 match with the postpartum 12 months, whereas on our homes, I think it's a 90-10.
90-10,
yeah. So that's actually a better deal for Arkansas.
No, it is. Yeah.
But the reality is we're still having this gap, so we do need to extend this program. And that's kind of what we found out along during the summer. We really were able to quantify the numbers better. So my hope is actually we're in a better situation now than we were before. And so, and I've been pushing that a lot. And I've had meetings with DHS, and I think we're going to see something hopefully in the next few months about a larger thing, though. They recognize there's a big issue here in Arkansas, and like we said, it's not a silver bullet, and I'm hoping we see a lot of broad overchange. So you talk about the two issues I would also do. So besides the expansion to the 12 months, I mean, I like to see better reimbursement for midwives. I think, you know, using them, I'd also like to see some sort of funding for training for family practice providers that are along this rural area to kind of help them. You know, I don't want them to be OBGYNs, not at all, but I do want them to be able to fill those gaps, because as we're doing a lot with more graduate medical education, GME, that's still a long time to get those doctors out in the field. So we have to work with the workforce we have right now to train them and get them to a situation where they can treat those patients better.
All right. What would let's talk about medical residency slots, because that's a big portion of it there, whether it's doctors or whether it's some other type of healthcare professional. What needs to happen there? Where can that money come from? How do you advance that?
Well, I'm definitely not your money person, but I can, you know, we know that we need more providers in our state, and what that looks like is very different depending on the specialty. With regards to obstetrics and gynecology care, I think Representative Pilkington hit the nail on the head. We need more family practice, midwives, providing safe obstetrical care throughout our state. It's really hard to get an OB-GYN into some of these communities because they do two things. They do obstetrics, but they also do gynecology. And these smaller rural communities and hospitals can't support the gynecology. And so we really need to create these collaborative networks where family practice, midwives, and OB-GYNs can work together and create a tiered approach to some of these patients. And so creating more of those slots will help that.
What would move the statistics in a better direction? I don't think it has to move in a big number to make a big difference. I mean, what are we talking about?
Gosh, Dr. Manning would probably know the exact number, but you know, I think I've said before, I mean, we could maybe move 20, 30 women, you know, those lives, which in the grand scheme of 3 million population is not a lot of people. If we are able to intervene and save them and keep those women from passing, I mean, our maternal mortality rate would sink like a rock. We'd go from being one of the worst states to being probably mid-tier.
20 or 30?
So the last group of women that we looked at, it was 38 women. Now, that's a little bit of a misnomer because morbidity is also something that we can't quantify. And morbidity is that long-term effect on the mom, on the family, on long-term health consequences. And it's estimated that for every maternal death, there's anywhere between 10 and 15 women that suffer from severe maternal morbidity.
I've got a couple more questions, but we're out of time. Will you guys stick around for a short web extra here? All right. Representative Aaron Pilkington, Dr. Nirvana Manning, we'll be doing something online with them in extension of this interview. We're back with more right after this.
You're watching Capitol View, Sunday morning talk focused on the political scene in Arkansas.
We ran out of time on air. We were having a conversation with Dr. Nirvana Manning and Representative Aaron Pilkington about maternal mortality, maternal health. Let's pick up from where we were talking. I want to hear a little bit more about what conversations are going on with DHS, with the governor's office, with your legislative colleagues. How comprehensive of something might we put together? I mean, I know that everybody's got, this has their attention now.
Yeah.
What are we looking at in terms of a potential package? Is there something that could be done in the fiscal session, or does it all have to wait?
Yeah, I mean, obviously I think there's some aspects that could probably be done in a fiscal session.
Like what?
Well, I think the 12 months extension, we could probably get that done. Reimbursement for midwives, maybe through some special language we can get that done. You know, I would say there's more than just me. There's a handful of legislators that really have delved in. This is a very passionate thing for them. But even as a broader thing, I think all of us realize here in Arkansas, we got to do something. This is bad. We hear about it every year. It's not getting better. And so that's why I think a lot of these bills you see that pass are passing with like 98-0 votes, because they understand we got to be doing something. I do think it'll be a larger package. I mean, we talk about reimbursement rates. We talk about maybe, you know, allowing more doulas, talk about funding for lactation specialists. I mean, there's more than just, you know, there's so much around this too. And even too, what is interesting ties into is, well, what about daycare services? You know, what about mental health? How does that play into this? It's not just the physical. And so even too, you know, recently I had a discussion with some at DHS about, you know, continuous glucose monitoring. CGMs have now been approved for gestational diabetes. You know, I don't believe any state in the country is paying for that, but obviously with the high rate of diabetes we have here in Arkansas, that might be something that we actually want to do. We know that it saves money for the general population. So, and then of course if we can do that and then hopefully see a reduction in C-sections, we'll see a better income or better outcome for some of these women. So there's a lot of things, and I think it's kind of working together. But some of the conversation I've had with DHS is also, how do we bring in some of these other players that are kind of non-traditional players in the obstetrics? You know, you have pregnancy crisis centers that now we give state funds to, but then also how do you use rural health clinics, community health clinics, some of these groups that are the only provider in rural area, how do we bring them in to say, hey, listen, you have to be part of the solution. It can't just be UAMS or St. Bernard's or Johnson Regional Medical Center, you know, pulling the weight. We all got to do it together. So I think it is going to be interesting to see how that approach kind of goes, of pulling people in saying, you've got the facilities, you have the workforce, maybe it's just training. So that's kind of been a whole package of how do we get more people involved, and then what are the roadblocks maybe to prevent those people from being
Did you see
better
how
partners.
he got his hometown hospital worked into that one right there? That's a good politician right there.
There you
He's
go.
just spun Johnson Regional right in there. So good job on that. Nirvana, you've been a part of some of these conversations too. I'm not asking you guys to betray any confidence, because I know some of these conversations have to be, you know, are just delicate right now. But are you satisfied that we are moving in the right direction, that there will be something substantial that can be done in either the next fiscal session or the next regular session?
I'm extremely optimistic. I think there are so many people around this state that really want to make an impactful difference. I've reached out to a handful of them. We have regular conversations. I know there's dozens more that I probably do not talk to. I really think there will be there's a lot of work being done to create a comprehensive kind of women's health program to address a lot of the things that Representative Pilkington discussed, as well as some of the things pre-pregnancy, ensuring that if patients do not want to become pregnant, that they have access to contraception, that there's multiple ways with which they can do that, access to long-acting reversible contraception, as well as now pharmacists can now prescribe contraceptions out of the pharmacy as well.
Yeah.
So we want to make sure that patients have access.
Real quickly, there's two things that have kind of come up in the news recently. I'll get either one of you can talk about both of them if you want to. The Arkansas Center for Health Improvement has recommended more doulas in the state of Arkansas. I don't know what a doula is necessarily, so I'll let you tell me what one is, and could that be helpful? And then secondly, there's a new group that has come together, a coalition called Arkansans for Improving Maternal Health, that I think is going to do more promotion and awareness of this issue of moms and infants there. Speak to both of those issues for me, either one of you. So.
I can start with the doulas, as I'm familiar with them, and on a professional basis as an OBGYN. I consider doulas very helpful. They are an extension of kind of the community healthcare worker in my world. They can help support that mother and create opportunities for access to different public health services that they would not get otherwise during pregnancy and especially after pregnancy. I do think in order for this program to be successful, we need a set of policies and protocols with which we need a scope of practice for them. We kind of need to get them on a national registry so that hospitals can see who's done the training, what they've done, and then I think reimbursement will be helpful at that point. But I think creating those bumpers will be very integral in getting buy-in from all of the players.
Yeah. Doulas or the new organization here, either one.
Well, I agree with everything Dr. Manning said about doulas. You know, on the new organization, yeah, I think it's great. You know, when I started working on maternal health, it was back in 2017. Speaker Jeremy Gillum sent me to a conference on women and children's health, and I would say when I came back and started talking about building a breast milk bank and all the things I wanted to do with maternal health, I probably got a lot more like raised eyebrows, like that's super weird. You're this unmarried with no kids, like a politician talking about like maternal health and breastfeeding and everything. But it's been a passion of mine, and as time has rolled on, and as we've gotten more information, more data, and we've got more groups like this coming together, coming out saying we need to do this, it's just kind of, you know, it's like a stone rolling down a hill. It's gaining more and more momentum, and so it's good to be a part of this, and it's great to see so many allies kind of coming out of the woodwork saying, you know what, we're going to fix this. I tell people all the time, I want to take Arkansas from the worst place to have a baby to the best place to have a baby. And I tell people too, it's not even just a healthcare issue. To me, it's an economic issue as well. If we want to have a workforce for the future, if we want to make sure that we don't see our small towns disappear all over Arkansas, we got to have babies. Well, who wants to have a baby if they think that there's a chance that they're going to die? Because it's you know, we're a first world country. You know, we shouldn't have this kind of issues going on, but we do, and so it's, you know, we got to get it right, and hopefully by doing that, we'll see our economy grow in the long term. So I tell people it's not more than just healthcare; it's everything.
Yeah,
so.
You've got some babies now too. So.
Yeah. I've got 2 and 1 on the way in June. So
all right, you're going to catch up with Nirvana here, and me. I've got 3 as well.
Yeah.
You've got
Oh, nice.
So yes,
All right.
we'll all be in the triple kids category there. All right, Nirvana and Aaron, thank you both very much. Appreciate you.
Thanks for
Thank you.
having us.
Appreciate it.
I appreciate it.
Thanks for sticking around for our Web Extra. I'm Roby Brock. We'll see you next time.